If you look at photographs of O'Shea McCarthy before he went to hospital, you see a young man who was fit and healthy, not someone who looked like he was going to be dead anytime soon. If you look at photographs later, shortly before he died, you see a man who looks like he's been struck by the plague, when in fact all he had to begin with was a relatively minor problem, and all he did was to do exactly what he was told by his doctors. When I say a relatively minor problem, what do I mean? Well, I mean that O'Shea McCarthy's problems, I think, began when he was given a drug called Levaquin. That's when he thought the problems began as well. This is an antibiotic drug. He didn't have an infection. What was happening was he was going for a small job to be done on his nose. In order to make sure there was no chance that he could get an infection, he was given a very high dose of Levaquin to have for a period before the operation and for a long period afterwards, which he didn't really need. Now, this is a drug that FDA came out a year or two ago and said it needs a black box warning because it can cause serious problems like mental health problems. They came out with this warning partly because O'Shea's mother gave a speech to FDA along with a number of other people who had been affected by this and related drugs, and there were speeches also from a number of experts who'd worked on the drug, and FDA recognized there was a real issue here. We're not blaming O'Shea's doctors for not getting right something that FDA have only recently warned about, although good doctors know about these things before bureaucrats like the people in FDA do. Good doctors knew in the 1980s that Levaquin could cause problems like this, and O'Shea very, very clearly told his doctors that he thought his problems began with Levaquin, and the kind of clinical picture he had is more consistent with something caused by Levaquin than by bipolar disorder. If you look at the way O'Shea presented when he came into hospital first, and the course of his illness afterwards, where if he really had bipolar disorder, his moods would have gone up and down, there's really no evidence that he had bipolar disorder based on that. This is pretty well the last diagnosis that I would have given him. So why did O'Shea's doctors give him this diagnosis? And the answer, I think, is because it was a fashionable diagnosis to give at the time. A few drug companies trying to sell their drugs a few years beforehand had realized that manic depressive illness, as it used to be called, had been relabeled as bipolar disorder. And you could sell the idea that Vincent van Gogh and all sorts of major composers and other artists had this illness, and you too can have this illness, but be controlled by having our drugs. It even got to the stage a few years before O'Shea came into hospital where a major best-selling academic book called The Bipolar Child said we can and maybe should be making the diagnosis in utero. When O'Shea came into hospital, there was a mania involved, but it was a mania his doctors had, not one that he had. But we're not blaming O'Shea's doctors for either missing the right diagnosis or getting the wrong diagnosis. Although in this case, it had some pretty serious consequences. They didn't treat him with the best established treatment for bipolar disorder, which is lithium. They didn't treat him with the most commonly used drugs for bipolar disorder, which are Depakote and carbamazepine, drugs that have better evidence for them than the drugs O'Shea was given, and drugs that are cheaper than the drugs O'Shea was given. They gave him lamotrigine, which is also called Lamictal, which is an anticonvulsant that I wouldn't give to anyone. It's a drug that is given to some people who've got bipolar disorder. The evidence is pretty poor and really only points to the fact that this drug may, if it has any effects at all, be of some use when people who have this condition, when the moods slip low. Put a person on it for too long, and leave them on it in too high a dose, and they can become physically dependent to it and have a withdrawal problem trying to get off it, in addition to the other problems this drug can cause. The other drug that they gave O'Shea was risperidone, or Risperdal. This is a heavy-duty antipsychotic drug that had been introduced 15 years beforehand for patients who have schizophrenia. But again, a few years before O'Shea came into hospital, the makers of Risperdal, along with the makers of other antipsychotic drugs used to treat schizophrenia, decided to repurpose this drug for the treatment of bipolar disorder. What's the evidence that it can be any good for treating bipolar disorder? Well, if you're ragingly manic, if you're tearing a house apart, throwing the furniture out the window, jumping in your car and driving at top speed around town, getting involved in drinking too much, gambling too much, prostitution and things like this, this drug can slow you down. It can bring you to a full stop if you put on too high a dose. So it can be useful in that way, but it's not a treatment to prevent the episodes of a bipolar disorder. It's not a treatment to stabilize you. Put you on too high a dose and leave you on it for too long, and you become dependent on it and have a withdrawal problem when you try to get off it. The other drug that his doctors gave O'Shea was Ativan. Again, this is not a treatment for bipolar disorder. It's a drug that a lot of doctors are very worried about. They won't put you on it for too long because they'll say to you, you could get hooked to it, and if you try to come off it, you might have a problem. But the problem here isn't that O'Shea's doctors missed the right diagnosis, or made the wrong diagnosis, or put him on lamotrigine, or Risperdal, or Ativan. They're all things that did happen to O'Shea. The problem in this case is something else that happened that can happen to you. The problem is, when O'Shea didn't respond, they didn't look at the diagnosis again and work out, well, have we made the right diagnosis? When he didn't respond, let's say they'd stuck to the diagnosis even though he didn't respond, the next problem is they kept to the same treatment for years. There are a lot of other treatments for bipolar disorder, better treatments that they could have tried. They didn't try. The problem was not only did they stick to the diagnosis and stick to the treatment for years, they didn't listen to him when he repeatedly told them what the diagnosis was, what the problems were that he was having with treatment, and was asking very, very clearly for some help because the illness and the way they were treating him was increasingly becoming his problem rather than the original problem that he had. But O'Shea was a person who tended to do what his doctors told him to do, even if he didn't think they were right. Now, his doctor's defense will be that they were keeping to the guidelines for bipolar disorder, and that they did all of the right things, and that if O'Shea ended up dead, this was because he had a serious illness and really nobody, not even the best of doctors, could have saved him. We're mostly forgiving people, much too forgiving. If there were any hints from the record that, that the doctors had reconsidered the diagnosis, we'd probably forgive them. If there was any hints that even sticking to the diagnosis, they'd reconsider the treatments, we'd probably forgive them. If there was any hints that sticking to the diagnosis and sticking to the treatment, that they were listening to him, we'd probably forgive them. We normally look for get-out clauses for them, but in this case, there aren't any. The keeping to the guidelines for bipolar disorder is a great idea, but there's a more important guideline, which is the guideline for treating people. We need doctors to listen to us, and when things don't seem to be going right, we need to make sure that they tailor the treatments in a way that maps on to what's happening to us. These days, the problem is if you take your pet to a vet, your pet is likely to get more person-centered care than you are when you go into the health services, and particularly when you go into the mental health services. O'Shea was a young man who should not now be dead. What killed him? Well, in one sense, it's irrelevant what precisely killed him. What killed him was the fact that his doctors were not working with him and not listening to him. But he was on a number of drugs which can interfere with your ability to pay heed to the things that are happening around you when you drive a car. He was on a number of drugs that can combine to interfere with your heart in a way that may block your attention when you're trying to pay heed driving a car. He is on a number of drugs, both when you go on them and when you can come off them, that can agitate you and get in the way of you being able to pay heed to what's happening around you when you drive a car. He was on a number of drugs that can all cause you to become suicidal. If you've got no mental health problems at all, ever, we can put you on these drugs and you can become suicidal in a way you never were before. He was on some drugs that can disinhibit you so that even if you had been suicidal before, but wouldn't have ever done anything, on these drugs, you may be likely to kill yourself in a way you wouldn't have done if you weren't on these drugs. All of these seem to be options in O'Shea's case to try and explain what actually happened, but at the end of the day, his death was a death that was going to happen, not because he had an illness that was serious, but because his doctors were not looking at him, where they could see the changes that were happening in him, and that these were all the wrong changes, are listening to him when he told them what was happening. That's the reason O'Shea ended up dead. There's a lot of deaths like O'Shea's these days. There's an increasing number of deaths like O'Shea's. You don't hear about them. You're hearing about this death because his mother loved him and because she's particularly tenacious and has hung in there to bring this case. She's brought the case because she believes you need to hear about his story. But you're not being asked just to give justice to O'Shea. You're being asked to try and ensure that the health services make treatment for you and your family and your friends safer than it now is, that they're not allow things to become increasingly dangerous as they are now becoming. And you're being asked to look after yourself and those you love, not just to pay heed to what happened to O'Shea. What happened to him is a terrible marker for what can happen to any of us, and we need to tell those who are treating us that they need to do better than they've done in his case.